Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Welcome back, everyone, to the Functional Code. Today is a special day. We have our first ever guest on our podcast, Josh. We are super excited to have him. Today he's going to talk a tremendous amount about blood work and lab values, what it means to take a deep dive, better look at lab work and blood work besides just the regular, maybe modern medical version of that. He's going to talk about gut health, which is a very important part of healthcare. We're going to talk life expectancy. He is also an expert on laser therapy, so we're going to get to hear a lot more about that. So we're super excited to jump into the podcast today. I am Dr. Addy.
And I'm Dr. Jace. Yeah, it's crazy. God, it's been 2 years since we've had Josh in clinic, and he is one of the kindest people, one of the smartest people on more alternative medicine outside of like chiropractic in terms of like lab values, in terms of just treating the patients from a holistic standpoint, and we're super grateful to have him. I wouldn't have asked for a better person, one, to work with on a daily basis, and then two, just to have on the podcast. So yeah, Josh, man, thank you so much for coming out, man.
Welcome.
Thanks so much for having me. I'm definitely honored, and it's a pleasure to work with you guys too. Like, you guys have taught me so much, and you guys care so much. Like, I tell all the patients, I'm like, I'm not biased. Well, maybe a little bit, but I said, you won't meet two better chiropractors. I've been to a lot of chiropractors throughout my life, and you guys are very thorough. You know, you guys look for every detail, and you know, that's what you expect.
For sure.
I appreciate it, man. Yeah, but no, let's see if we can pick your brain the best we possibly can, but no, we appreciate you. So I guess let's start, especially for the viewers at home and who are listening. I guess where did you go to school? What was some of your experiences with clinics that you've worked at in the past compared to now? And yeah, we'll dive into.
So for bachelor's, I primarily went to Brooklyn College, which is located in Brooklyn, New York, and I got my Bachelor of Science in Biology over there. And then from there, we moved back to where I'm originally from, is Florida, and I went to Physician Assistant program at Barry University. Yeah, it's a smaller school, but it was an amazing experience, and you know, they really educated us and prepared us to like get out into the field day one. So
Did you always want to be a PA? Was there other things you were looking at doing when you were making that decision?
So ever since I was younger, I wanted to go into medicine. As time went on, you know, like I kind of, you know, delved deeper into the different specialties in medicine, also through experiences. So it actually led me to becoming a PA because I didn't want to do those 80-hour residencies. I wanted to get to work right away. I knew it would burn me out. I didn't want that. But it's funny that right before I was supposed to leave to PA school, I was like, do I really want to do this? Because I became very interested in natural medicine, mostly Oriental medicine. I had a very good interaction with this acupuncturist, and she helped myself and my family. And I was like, wow, maybe, you know, this is the way. I'd already been into natural things, but this really brought me to the next level. But everybody told me, they're like, go to PA school because you'll have authority. You know, you don't know what's going to be if you go to Oriental medicine program. Just do that, and then you can do that afterwards too. That was my path, and that's how I'm here now.
So when you
That's
were
so
going
cool.
through school, did you feel this kind of internal maybe clash of philosophy versus what you were learning at school?
Yeah, like every day, every single day, especially when we got into the pharmaceuticals. That was really difficult for me to handle. And what I would do is, as we were discussing, let's say, a diagnosis and how to treat it, I was on my laptop looking up natural ways to treat it. And I was comparing like side effects and the necessity to be on these drugs when the research was there. I mean, I wasn't just, Googling and going to like just blogs. I was, studying scholarly articles, and yeah, there's just so much evidence. I'm like, why aren't we talking about this in school? There were a few times I got into, let's say, disagreements with some of the professors. And there were times that they actually would agree with me. I would say, I remember this one time we were talking about statins, right? Sure. That is, I think it is the most prescribed medication. It's definitely one of the top three, but like, your Lipitors, your Crestors, right? Because heart disease is the number one killer. And the link that they make is that, we have to lower cholesterol, because if your cholesterol is over a certain number, you're more likely to have blockages and therefore heart attack or a stroke. So they push it. Now, the teacher was talking about the guidelines, right? There's actually a score. Like, you need to have a certain score in order to have a necessity to prescribe the statins. And you need to have, let's say, coexisting conditions like diabetes, family history of heart disease. There's a lot of different aspects and different criteria that you need. Now, the thing is, I would say half of the patients that they prescribe these statin drugs to do not meet the criteria, and it's just because they have high cholesterol, right?
That drives me crazy.
It's a single criteria or qualifier, but they're looking for multiple. Yeah. They should be looking for multiple, but they choose to just see that one qualifier and consider that good enough. Is that kind of what you're thinking?
Yeah. And the thing is, like, it wouldn't even meet the guidelines to prescribe the medication. So they're even going against their guidelines. So yes, high enough cholesterol number along with the other, you have to have something else. Like, it has to be diabetes, or you've had to have a stent put in, or some sort of intervention, family history, something, right? And it's not there. And I asked the teacher, I said, why do we do this? She's like, you're actually right. She's like, they just do it because they think that it is the best thing for the patient, and it's preventable, and they don't see any harm. That I think the main issue is with a lot of the medications is that they don't see the harm in the medication when it's obviously there. It's blatantly clear. I mean, you could go to WebMD, see the side effects, but you look at, let's say, the chemical pathways and the enzymes and enzymatic reactions and stuff, and it's very easily apparent that it can destroy a lot of other processes in the body.
In long-term statin use, what are some things that people see?
Yeah, like, and related to, the practice of chiropractic, and which is something that can interfere, right? You can see sarcopenia, right? The main side effect that people get is they're like, oh, my legs are hurting. It's not just your legs are hurting, your muscle and your legs are breaking down. And that causes a whole slew of issues. But if you look a little bit deeper, what it does is it causes mitochondrial dysfunction. And this is where it's so oxymoronic, right? It's such a paradox. It's like, what are you trying to prevent? Heart disease. Which organ in the body has the most mitochondria? Is the heart, right? Because it is the muscle that constantly has to pump, right? Skeletal muscle, you're not always using, right? It's it's relaxing at a certain point, but cardiac muscle is never relaxing from before you're born till the day you die, and so you need the most mitochondria because mitochondria is what powers the cell. That's what provides the energy for the cell. And so what statin drugs do, you see the cascade of chemical reactions. So early in that process of enzymatic reactions and stuff, it interferes with the production of CoQ10, right? And so if you interfere with that, now the mitochondria starts to break down, because CoQ10 is coenzyme Q10. Yeah. And so basically what it does is it shuttles electrons across the membrane of mitochondria and helps you produce ATP, produce energy. And it's a very vital coenzyme. And so if you rob the cell of that, you rob the mitochondria of that, you're not producing any ATP, any energy. It breaks down the cell. So therefore, the muscles break down. But think of it, every cell breaks down. A cell can't survive without the mitochondria being fully functional. And that's why you start to see other things besides, let's say, skeletal muscle breakdown, heart muscle breakdown. But you also start to see dementia in older patients. And I think more doctors are starting to recognize that, geriatricians. And it's detrimental. Statins can be detrimental. Now, are they necessary sometimes? Yes, but a lot of doctors won't even recommend, hey, you should take a CoQ10 supplement with the statin. Just do that. It's so simple. They're not doing it.
And do you think they know this info? Do you feel that is something that they were taught in school or have even gained any knowledge of since post schooling? Do they have this in their toolkit to know?
Yeah, that's a good question. Like do they know and they just don't do anything, or do they not believe that the patient will be interested? Right. That's always the question. It's very easy to look up, right? But it's what you choose to discover, right? In PA school, they always use the line like, you'll never be able to diagnose something unless you look for it. Right. So true. So like you have to be willing to look for it. I remember like when I was on rotations, this was my first interaction about CoQ10. I was on a cardiology rotation, and I was one of the papers we had to write a couple of papers in PA school. So one of the papers I wrote was the link between CoQ10 and heart failure. And what I found in the paper was that there's a direct link between CoQ10 deficiency and heart failure, but they weren't even sure if you gave CoQ10 to a heart failure patient, if it would work. The conclusion was that, yes, it would work, but you have to give the right type of CoQ10. But the ubiquinol form is the type you want to take when you have heart failure. So you have ubiquinone, which is like the inactive form, and ubiquinol, which is the active form of CoQ10. Yeah. And you can incorporate that pretty well into the body, but it has to be in a certain carrier, and ubiquinol is the active form. So people with heart failure, they tend to have more edema, and so they don't absorb things as well. So they found that you need to give very high doses of the active form ubiquinol. So I presented this to the cardiologist I was rotating under, and he was like, really? Like, I kind of heard about that, but I didn't know about that. And I'm thinking, like, this is your field. Why are you not making the extra effort and studying this? But I think what happens is they go to medical school or PA school, and their education ends there. Yeah. And then what do? They rely on the pharmaceutical companies to feed them the extra information, right? The new drugs that are coming out. Right. They'll go to get your continuing education credits. They'll go to these seminars, but what do they talk about? The drugs. Right.
And the pharmacy doesn't make money off the CoQ10, right? They're not pushing supplements in the pharmacy, really. So why would the hospital push or want them to do that when there's no money to be made anyway with that kind of thing?
Exactly. You can't patent it. They try with some of these things, like with omega-3. Like they've done that. They have their own Visipa, and it's a high dose of EPA, but honestly, like you can get an omega-3 over the counter too. But they try. Like if they can take advantage of it, they would love to do that. And there is a push to regulate some of the nutraceuticals now, the supplements. And because the whole reason behind that is that they want to take hold of those things so they can patent it, right? What other reason? Because it's working for people. It's not causing any side effects, right?
And it's a $1 billion industry. It is.
That's what we're up against all day long, every day. And even go back to your point on like the education. I feel like there's so much research coming out too, where it's so hard to keep track of. But like if you're not staying up with the day-to-day newer stuff coming out, or even just like the systematic reviews, it's hard to incorporate half that stuff in. I mean, we see it on a daily basis after like grad school. I'm sure you see it as well. And it's one of those where it's hard to keep up, but if you are listening to either podcasts or research articles or anything like that, that's awesome. But yeah, and it's hard to get to the point to where at certain parts for practitioners, if they don't know then like how in depth certain topics can go and the nuanced things, it's hard on that side. I can't imagine from your perspective on lab supplements, mixing in that also with the medical side. I thought that's not easy.
Yeah, it takes an extra effort. It's like you're at work, you're working 8-9 hours a day. I mean, some of these doctors are working really long hours, and when they're off from work, they just want to relax. They don't want to put that extra effort in. I think the time to do it for doctors would really be like the first 5 years, because before you get burnt out. While you're still young, while you still have energy, that's the time to do it. But what happens is, I think students are so confident in what they learned, right? And they're like, oh, it's pretty recent, so I don't need to learn anything else. And so they take that and run with it. And they're also learning how to actually put into practice what they've learned too. So there's a lot of difficulty. So I understand it. But my recommendation would be to any students out there, whether PA, nurse practitioner, doctors, doesn't matter, or even if you're in the natural medicine field, you can't just take it face value. Like, you have to do your own research. Take advantage when you're young, energetic, before the kids come. So because you won't have that much time later on.
Yeah, you're only going to get busier, right?
Family and there's just so much there. Cool. So like going back into some of the stuff that you're talking about, and this is a topic that I know you're pretty darn good with from a wide spectrum, and then dive into depths of more lab values. Because I know I've had this question asked numerous amount of times, and I've heard different answers from other providers, but how often in terms of lab work, not only just a general panel, but more of a specific panel if need to, how often should that be done? And is it one of those to where it should be done for everyone of the general public, or what's your thought process on that?
Yeah. I think there's a lot of specifics. So like it depends how old you are, right? So if you're older, you need to get your labs checked more often. Like while someone our age can get by with just annual labs, I think someone who's, pushing in their 60s, or even 50s, should get labs done twice a year, at least. Right, biannually. Now, if you find something on the lab work that's not optimal, right, not within optimal range, and I guess we'll talk about that soon, because I don't want to just look at like whether it's within range or out of range. I don't want to just look at abnormal values. I want to look at optimal values. So even if something's suboptimal, you can retest 3 months later. And also it depends on the actual specific lab that you're testing. So for example, I think like things like CBC, right? If you see something's off, you want to repeat the labs relatively quickly, even like in a month, because, there could be something more serious at play there, whether it's cancer or some blood disorder or whatever, and you can know who to refer to. And so you want to tackle that. Something like cholesterol, you can make changes in cholesterol relatively quickly, so you can even test in 6 weeks. You could get deeper into that, but cholesterol, there's a lot of reasons why cholesterol would increase, and it's not all diet. It could be emotional health. Like I remember reading from Dr. Steven Sinatra. He's a metabolic cardiologist. He's an MD, but he talks about the emotional aspect of things. He was saying about himself, he's like, I tested my cholesterol on a very stressful day. I had a very stressful day and at work and had my cholesterol test, and I was like in shock. I was like, my cholesterol is really high. And then, I don't know, let's say it was 200. And then he's like, I know stress is a definitely component. And so then he got it tested like a couple weeks later when, the stress started melting away. He didn't change anything in his diet or anything like supplements or anything. Just his stress level was less. And he said my cholesterol like just dropped by like 30 points. So, a lot of the labs can change on a dime. You never know. Thyroid also, like when you start, let's say, prescribing thyroid medication, let's say I like to use glandulars. We could get more into that if you want, but you're supposed to test 6 weeks later to see how the numbers change. So I think it all depends, but on a general basis, like I would say, like younger people can get tested annually. If they really want to like optimize, I would say twice a year or biannually, but people who are older, at least twice a year, if not 3 times a year.
And I know you touched on this, but I think this would be a great segue to, you have, of course, if you've ever gotten your blood drawn, there are numbers right next to it, and you'll notice it'll maybe say low, high, or normal.
Yeah.
And that number is a general median of the population that we have day to day, right? Mm-hmm. But I'm sure maybe you can even touch on this. Over time, those values have actually changed because the population has changed.
Yes.
So do you maybe want to touch on what that means? And then how do you, as a functional medicine provider, actually look at the values comparative to that?
Yeah, it's really interesting. So to go into like more specifics, like about what you said, with blood sugars, I find it very interesting that like when I worked with a geriatrician, he would see hemoglobin A1C, which is a 3-month average of your blood sugar, right? And he would see it at 6. And for me, that's alarming, right? Because the person's like pre-diabetic, it's not a good place to be in. And he was like, it's okay. As you get older, we find that people's blood sugars can go up and your brain needs more glucose. I'm sure like there was definitely research behind that. I'm sure he didn't just, pull out of a hat. But I mean, we know the effects that high blood sugar have, especially in older people. Like David Perlmutter calls Alzheimer's type 3 diabetes. Yes. So how important is it that you maintain the blood sugar? It's not all about the sugar. It's about the insulin receptor, right? So I think that's where doctors get caught up a lot in the end product and they forget the underlying things. For example, the cholesterol. And this goes the other way, right? So a lot of doctors are trying to push cholesterol down, like really, really, really low, right? Why? Because their whole focus is on heart disease. And like you said, the average person like can get their cholesterol down a lot lower, right? We're seeing that with statin drugs. So like, oh, the expectation is to get a lot lower. It's very hard to adjust the blood sugars, right? So they're just like, it's okay, 6, you're fine. But cholesterol, all of a sudden, you're plummeting cholesterol like really, really deep down into, I would say, dangerous territory for other functions of the body.
You want to just give a normal range of cholesterol?
Yeah.
What is the dangerous level?
Yeah, so like cardiologists now are recommending that the LDL be, I think, is below 50, because if you get it below 50, you have almost no risk of a heart attack, right? Because like there's nothing that can block the arteries. Meanwhile, there's a lot of other things at play that can cause damage to arteries, but we can get more into that. But they try to get the LDL under 50. The issue is that, the statins also bring down the HDL, the good cholesterol. So HDL is like, HDL and LDL are lipoproteins, so they actually shuttle cholesterol. So they're carriers, and so the HDL pulls cholesterol away from the arteries. But it lowers the HDL too, and so your total cholesterol goes extremely low. We're talking about like where they plummet it to, the normal level you're supposed to get is, I think optimally is below 150, they say. But I've seen cholesterols in double digits, like total cholesterols in double digits. A lot of cardiologists are comfortable with it because their whole focus, they're like, what's the number one killer? heart disease. We just want you to live.
Oh, that's their base.
That's a poor aspect or philosophy on preventative medicine.
Yeah.
It's like keep you just alive enough, but don't flourish.
Yeah, you won't have quality of life, right? You're going to hobble around.
But you're not going to have that heart attack.
Exactly. You're not going to your heart might fail, right? But at least the arteries, the plumbing is fine. Right? And that's the disconnect. It's like, imagine, I'm just thinking of this analogy now, but let's say you have a plumber, right? Yeah. And an electrician, right? And let's say, the plumber's like, I got to make sure that, hell or high water, I got to make sure that the plumbing's intact. And so like your electrician, your wires are interfering with my plumbing. Right? I can't get this pipe through. I need to get this pipe through. And I say like cardiologists are more like plumbers, right? Because they have to make sure that the blood is flowing. And so an electrician's like, hello, like you're not going to have any lights, right? You're not going to have any heat in the house. Or in Arizona, we're not going to have AC. So like it's basically one specialty is focusing so much on their priorities, right? That they forget about the rest of the body. There's a major disconnect. And so that's where like holistic practitioners see the whole body. So remember we had this one patient, but I've seen this throughout the years, but I primarily remember this one because he looked healthy. He tried to stay healthy. He actually would take supplements. Like he really cared about his health. He wasn't just going along to get along and just letting the doctors take over, but his cardiologist convinced him so much that he had to get his cholesterol under a certain number. He did have a history of having a stent placed. So, yeah, it was important that he get his cholesterol intact. But there's a lot of other things that they should have been concentrating on. What he also was experiencing was sarcopenia. Yeah. His muscles were wasting away. He told me, like, he just wasn't as strong. His muscles didn't have as much tone. And he also started to develop osteoporosis. This is a guy in their 60s. There's no reason, with women, the hormones fall off. Men, it doesn't really happen so often unless you destroy the testosterone. You can't produce hormones without cholesterol. Cholesterol is the building block of hormones. So you tank the cholesterol to like really, really, valley numbers, and you destroy the rest of the body. And hormones, remember, signal everything. There's signals in the body. So there's no signaling pathways. You rob the brain, right? The brain needs cholesterol, right? It's made of fat, right? The cell membrane, right? You can't have proper contact from neuron to neuron. You need to maintain the health of the cell membrane. That's the number one thing with neurodegenerative disorders and neurodevelopmental disorders, is that you have to focus on the cell membrane, phosphatidylcholine, omega-3, right? And you are robbing the body of that. And they're not even telling patients, hey, like, raise your HDL by taking omega-3. Get the good fats. So there's just a major disconnect.
And we see this often too, to where if you see other really good practitioners, they have a decent idea in multiple areas. We find that too, the same with chiropractors. I'm sure same with medical doctors. Like, the more knowledge you have in other fields, the better you can also look at your own field and then even make more hypotheses depending on what patients have and what they present with. But I think that is incredibly important, not just coming out of school, but to keep learning and keep understanding what is the new research coming out and how does that involve and impact all the other systems of the body. So I absolutely love your analogy, plumber, electrician. Like, that's so cool. And it speaks so much truth in terms of how, like I said, one specialty looks at one, but if that can also impact this. And I know you're talking about hormones, which act on more of like a weekly, monthly basis instead. To a certain extent, some can more go on a daily basis and how they can affect the body throughout. But yeah, no, that's really, really cool. So I guess in terms of moving forward, yeah, Doc, is there anything else you want to ask on that one?
Yeah, the only thing I think would be a great way to have others understand what the differences between functional versus regular, how would you state that to a patient that maybe you have lab values in front of them and they're asking, okay, why should I want to focus more on the values that you want? And why is the medical system's normal not what I should be shooting for?
The medical system basically does not want to treat the patient until they are dire. Right. They don't look at gray areas. It's like there's black or white. Like, are you likely to die within the next year or two because of what you have? Yeah. And so therefore we need to treat you. Yeah. Functional medicine practitioners, we not only want you to live, we want you to live a quality life, and we want you to have longevity about what's going to happen next year or two. We think way ahead, right? We prepare way ahead. So even when it's actually more important, to keep someone healthy when they're younger. So even if they decide when they're retired to go mess around, they go on cruises and don't eat well and don't exercise, and it's not as detrimental if they had taken care of themselves when they were much younger. But all of a sudden, doctors wake up when the patient's 65. Now they have Medicare, right? Before they didn't, should I really go in? I have to pay for the visit. I have Medicare. And all of a sudden, their doctor's their best friend. It's like a social scene. It's like, oh, I'm going to go talk to my doctor this week. And there's reciprocation also, right? There's that reciprocal energy. And so doctors tend to pay attention more, start doing a lot of testing later on, right? All of a sudden, they're sending you, like, for when you get older, colonoscopies, and for women, breast exams, and they're looking closely at markers. Yeah. But even then, they totally miss it, like, because they're looking only at abnormal values, because they're only looking to see, are you at risk of dying within the next, 2 years? 5 years is generous, right? But we want to look way ahead so we can prevent something from ever happening. And it just upsets me because it is more cost effective even. Like, why wouldn't you try to prevent something? Like, yes, it costs you money right now, but you'll be spending a lot more later on. People think that they're not going to end up spending money later on, like, because they have Medicare, but it's not true. There's so many gaps in Medicare that they add, hospital stays that eventually it doesn't cover it, and they have to pay out of pocket. Yeah. And when you're on a fixed income, it's difficult. So, educate people earlier on. Yeah.
I wish it was, and this can obviously overlay into what we do too. We wish we could put that feeling inside of you in the future, right? Mm-hmm. Like, we wish we could let you feel what a bone-on-bone knee feels like, so you took care of it now. Right. We wish you would be able to feel what it's like lying in that bed, about to get a stent in, or needing something before you actually have to get down that road. Like, we wish there was a way for you to put yourself into that perspective, and it's just never going to happen. And I think the only way we can have patients truly understand that is, most of them learn the hard way. And that's just humanity, I feel like. We're just always constantly learning the hard way. But until it happens, we now have that perspective. And if there's a way around it, I can't wait for us to get there. Maybe AI can do that. I don't know.
Or
but
videos or something
seriously,
like that.
if there is a way for them to finally gain that perspective without actually getting there, I think that's a possibility. But until then, it's doing the best we can.
You guys have it the hardest, because when do people pay attention to musculoskeletal issues is only when they have pain, right? And even in our practice here, right, their main goal typically is like, I want to get out of pain. And then once they're out of pain, they're like, I don't need you guys anymore. And so the likelihood that you're going to return to that pain is much higher. Like, you don't want to experience this anymore. So and I think in this practice, like, we educate them about that. It's not all about the pain, it's the function. Because like, we, I know, like, we test them we have re-exams with like range of motion and stuff. But I think we do it all the time, right? Like, just on a daily basis, we're like, they're like, oh, I feel really great. I'm like, okay, go ahead and move your like lift their arm up, they're like, "Ooh, that still hurts." I'm like, "Okay, so you're not ready yet."
That's a good point too. Like, yes, you're at pain, but can you do the movements of what you want to do? Like, half the people are like starting to be parents now and play with their kids, get on the ground. I'm not in pain when sitting and walking, but I don't think I can quite crawl on the ground yet.
Yeah.
Man, same thing. It all depends on where you're at in life and all that other fun stuff. But God, that process.
I think AI is going to change everything as long as it's used for the right thing. For sure. Yeah. As long as it doesn't go Terminator before, right. I think AI can be so beneficial to catching things early. You know, I would say even like, can you imagine like if AI could scan the spine and tell you like, because the spine is at this angle, you're likely going to have degeneration within this many days. It's going to tell you like to the day, and you're like, whoa, like I got to do something now. Like the countdown is starting now. Like every day it's a day closer. I think it's starting more, I think, with cancer testing, and I love it because like it's less invasive, and so patients are more likely to do it. Like with a colonoscopy, I think people are very, very hesitant to do a colonoscopy just because it's so invasive, and also the preparation, and you have to go under anesthesia. No one wants to like, be asleep and be vulnerable. Now they have tests like blood tests. Like I think a blood test just came out for colon cancer, and it's 82% accurate. That's more accurate than a colonoscopy even. And so like a simple blood test, but these things. These tests have been around for a while. Like I worked with a functional medicine doctor, and we used to run a blood test that used to screen. There's one vial, and used to screen for, I cannot remember the marker, but if this marker was elevated, the likelihood of cancer was much higher, and then you could go, delve a little bit deeper and get more detailed testings. But so this technology has been around, but it hasn't been adopted yet. And I think it's out there. Radiology, I think that's all. I mean, I think eventually it'll get to like, just musculoskeletal disorders, but they're using it more for immediate urgent use, like to detect cancer. So AI can detect things on an X-ray and a CT at a much higher accuracy rate. Right. And you're also like what happens is you unnecessarily do procedures. Like you'll be like, sometimes there's also positive errors. So like, I think that happens a lot with mammograms. They're like, oh, it looks like it could be cancerous. Right. And a lot of times it's not. And they'll start, taking tissue off and doing biopsies, and that can cause issues in itself. And so it goes both ways where, you have negative errors and you have positive errors where you may not find things, but also sometimes it'll pick up things which were never an issue. There's a lot of things that have been around for a long time. Thermography. Thermography is very, very accurate. If there's a warm spot, inflammation, it alerts you much earlier on. But a lot of conventional doctors will say that's quackery. I don't know how it is, because like if there's heat in that area, there's a disease process going on.
Because cancer is very vascular, right? There's probably an uptick in blood flow or blood, at least in that area, comparative to the tissue itself. Exactly. I know that when I had gotten an ultrasound done, I was having spleen issues after COVID. I didn't know I had an enlarged spleen after COVID. And so what they were going through, and they were wondering, because I also at the time had a cyst on my testicle, and I thought it was cancer. So they were doing that, and they were saying, actually, you'll see a huge uptick in blood flow if it is. And we spotted it, and there was nothing. It was a cyst. So I was like, oh, so that's how it works. They look for this just upregulation in blood flow because it's just so vascular. So that makes a lot of sense that it would catch on more warmness on the thermography. And it's usually less invasive with thermography, right? It's kind of more of a scan.
It's a scan. They like mammogram, they have to squeeze the breast. It's very painful. And it's also radiation. And radiation causes cancer. And, mammogram, you have to do it like every 2 years. And if they possibly detect something, then every year. And then if a woman has fibrocystic breasts, they're going to pick stuff up, but they're just fibrocystic, and it's a positive error. So it's just invasive, and it can cause more damage. And with cancer, like, so you get like the angiogenesis, right, where you get development of new blood vessels to the area. Cancer is very smart. It's like, how are we going to survive? Let's create more blood flow. Cancer cells just, man, if we can create healthy cells like that, the same way, that's how you would heal.
And we just talked about that on a recent podcast, is Dr. Yamanaka, who created induced pluripotent stem cells. He won a Nobel Prize for it. He now has the ability to turn either dying or dead cells back into a stem cell. And that was done in 2012. But adoption-wise, we're not even starting with it. No one's even started with it. But we now have the ability to take dying dead cells to regenerate them, and we're still not even doing it.
Could you even imagine the neural link and the connection of the nervous system? I know it's being tested on like other patients more for like neurodegenerative diseases, but you add that signaling in with other lab tests, gotta give it like 20 some years.
We're never gonna die. I
mean,
mean,
it's crazy.
It's pretty much impossible, right? If you maintain the health of the tissue, that's all you need.
God, when you brought that up 2 weeks ago, I was speechless.
I'm excited for that. That's where I'm excited, just to see where we can take. My guess is they're going to go right to what's most important, right? So dying or dead nerve systems such as the MS and the Alzheimer's, and that's where they're going. They're going for heart failure. They're going for liver cirrhosis. They're going for the stuff that, I doubt pain is going to be really anywhere down the short road, right? It's probably further down the road, but super interesting.
That's incredible. But that's what pain, what is pain, right? Pain is just the cutoff of circulation, right? It's like, why do things hurt? Is because you're not getting the circulation. It's our body's way of telling us that something's wrong, right? That's a heart attack. Like, your chest starts to hurt because you cut off a blood supply. So like, I guess theoretically if the tissues are healthy, right, pain is gone. That's unbelievable. That's incredible. That's definitely the future of medicine, is just regenerating the tissue.
Well, that's a good point. So the future, I think this has gained way more traction in the last 10, 15 years. I know you and I were just having a conversation about this the other day, about some of the newer bacteria that they're looking into. Akkermansia was one of them. We may get to that or we may not, but I remember going to a seminar when I was over 10 years ago, and a gentleman talking about Akkermansia. And
What is
Akkermansia? It's a type of gut bacteria.
Okay.
And he was like, you need to look into this now. This is going to be a big thing. And within the next 10 years, I never heard anything of it. And now they're making supplements for Akkermansia. And I was like, I remember hearing about that. But I know you work extensively on patients in as far as gut health goes. So my first question is just, where did we finally start understanding the importance of gut health? And why is that starting to make such a large trend now in healthcare?
Yeah, I think they thought like just bacteria was harmful for many years. It's the germ theory. It's like, right? And so you come in contact with a germ, like a pathogenic bacteria, and it causes toxicity in the blood, right? And sepsis, and it can cause like tissue death, and just on a mild form, just like digestive issues, right? Then they started recognizing, they're like, hold on a second, like we are actually, I think it's 10% of our makeup is bacteria. Sure. So basically it's like an alien living inside us. Yes. I was watching this thing on X where it's like a zombie locust, and like there's a parasite got a hold of it, right? But it's dead, right? The locust is dead, but it's still moving. Yes. It's because the parasite is controlling it. Yes. And so the funny thing is that just that analogy is like the bacteria is actually controlling us. Yes. And so they saw that when they actually were able to start testing the stool and test for, like when they did analysis, and they saw all this, this gut flora, like normal gut flora, right? And like we call that like the commensal bacteria, right? It's a normal part of our system. Yeah. They noticed that they started studying, they're like, oh, we found the link that we know that this person has this disease. And when they looked at the disease process that person had, whether it was an autoimmune disorder or a neurodegenerative disorder or digestive disorder, and they looked at the stool and they connected the two things. They started seeing trends. They're like, hold on, we're seeing like major correlations between having this level of bacteria or introducing this pathogenic bacteria or having too much of this even friendly bacteria. And they saw changes in the person. So there's a lot of correlation. Now, the causation, they're still working on that, right? It's not clear cut. But they know that if you, like with Akkermansia, right? We spoke about that. But when they give Akkermansia, they can now see like chemical pathways. So they now saw that Akkermansia increased something called GLP-2. GLP-2 is found in the gut. And what it does is it's a peptide that is responsible for metabolism. So it can actually regulate your weight, regulate your blood sugar. It's fascinating. And I think, and then I looked up, and it also affects GLP-1, which is like what Ozempic targets. But if we eat prebiotic fibers, and that supports the gut, now all of a sudden, all these things come into fruition. You start to see chemical changes in the body. So they noticed that bacteria was very helpful and necessary for the health of the person. And I think where they really, really started seeing it was in newborns, right? I think, you know, like a lot of the concentrations later on, like people taking probiotics and stuff, but a lot of the detrimental effects that happen when the bacteria is wiped out is seen within the first, say, week of life even. Why? And it's terrible because you have strikes against you, and it's very hard to climb back. So people who have those negative effects, and to no fault of their own, it's just like they had no control. They were just a week-old baby. What can they do? But think about it. So vaginal birth versus C-section. Passing through the vaginal canal, they noticed that babies who passed through, had vaginal birth, they had less allergies, less asthma, less autoimmune disorders. And so now what do? They used to clean the baby, wipe them off. Now what they're doing actually for babies with C-section, that were C-section babies, they're taking the vaginal flora and they're wiping it on the baby's nose, eyes, mouth. They're wiping it all over the place. And because they saw that the positive effects later on, the babies had, even babies themselves have less colic. Yeah. Because what is colic? They thought, the baby's just gassy. Baby's always lying down. They're too full. But now we're starting to see not just food sensitivities, right? It's like, mother eats broccoli, and so the baby gets gassy. It's a lot more than that. Actually, there's a specific bacteria. It's Lactobacillus rhamnosus, but it's a certain strain. So like you'll see on probiotics, you don't want to just go for the name, like Lactobacillus rhamnosus. For sure, not just Lactobacillus species, but then there's more specific. But then there's a certain strain. There's like a number after that. That's what you want to see on a probiotic because those are well researched. There's a reason why they picked that specific Lactobacillus rhamnosus. And so they found, I think it's rhamnosus, not plantarum. I could look it up in a minute. And the funny thing is that Gerber caught on. Gerber, out of all companies, and I recommend this, to parents. It's a Gerber colic probiotic. It's just drops, and there's other companies that make it too. Sure. But Gerber adopted because they're like, wow, this stuff really works, and we could also sell it for $30 for a little bottle. But it's unbelievable. Like we used it on my youngest one, Nava, because we realized I knew more about the microbiome at that point. Like early on as a PA, I knew, of it, but like I started delving deeper. But by the time she was born, I was pretty familiar with them. The way to attack it was with a probiotic. Yeah. And so we started doing that. It was like magic. It was like a day or two later, it was unbelievable. Also, we noticed we started changing the formulas. We actually used a goat milk formula, which they use in Europe. I hope they don't come after me. The authorities don't come after me. She's very healthy now. But over here, they don't allow goat milk formula for newborns. They have to label it. In Europe, they do. They have goat milk formula for newborns. Here, they have to label it for toddler, like 1 year and up. It's the same exact formula, but they have to label it as such. This has very much to do with the gut. Why? Because, we talk about microbiome. But also we have to talk about other factors that can cause leaky gut. And we could talk about leaky gut in a minute and that process. But for example, so cows, for the most part, have a certain type of casein, right? It's A1. There are cows that are A2, right? There are cows that produce A2 casein. Casein is the milk protein. Now goats produce A2, right? So that works much better with our system. It's much more similar to our genetic makeup, so therefore it works better for our gut, and so you won't see that intolerance. Also, goat milk has a different lactose content, but even such, it's not really the lactose so much as it is the casein that can harm our gut. And so when we switched to the goat milk formula, it was unbelievable. And also, goat milk has a lot of immunoglobulins, right? Lactoferrin. And bovine also does if it's processed in a certain manner. If it's too denatured, then. But now they're starting to, in some formulas, they're starting to add colostrum to the formula, which is incredible. I think that's an amazing advent in formulas, because especially babies that are not breastfed, it's not all about just the macronutrients with breastfeeding. It's also about the little things like lactoferrin, right? Lactoferrin is a protein, and it helps get rid of pathogenic bacteria. It actually can bind and get rid of pathogenic bacteria. Lactoferrin is a protein, and it actually helps transfer iron out of the gut. Okay. So if someone has iron overload, it can help transfer iron out of the gut. Why is that beneficial for the gut? Is because a lot of pathogenic bacteria feed off of the iron in the gut. So that's one of the reasons why colostrum is beneficial. But the main reason is because it has all these immunoglobulins, right? And it helps upregulate the immune system in the gut. It actually increases the IGF-1 inside the gut. Really? But it doesn't affect, officially according to research, it doesn't affect the IGF-1 in the rest of the body. Just the gut, it causes the gut lining to become thicker and so less permeable. So therefore you get better absorption, and then you don't let toxins in. So the gut barrier is just more solid. It doesn't have those. We could talk about leaky gut like just very simply, but what leaky gut is that in our gut we have this one cell thick epithelial layer of the gut, and so we need that. Why? Because it allows things to pass from the gut, nutrients pass from the gut into the bloodstream and absorb into the bloodstream, and vice versa. It allows toxins to come out of the bloodstream and they go into the gut and excrete it. And then we have these tight junctions. We have cells, and they have these tight junctions, and they have to be tight enough where it becomes like just one lane this way, one lane that way. So bad things out, good things in. Yeah. Now, when these tight junctions open up too much, and that's what happens when there's pathogenic bacteria or food sensitivities, or even if we have overgrowth of even good bacteria soon. But when you have that gap, and the gap is too wide, it becomes a mess. Imagine like if traffic was going both ways on the 101 here, and they even took off the stripes for the lanes. There's just no lanes.
Anybody in, anybody out, right?
Exactly.
Well, and I think too, when I have always tried to have patients understand what that is, because I had it before too. I've had leaky gut issues, and it took me a very long time to take care of it, but anything I ate was painful or harmful. It was to this point where I was eating what I would consider as healthy as I could be, and I still had issues with my gut. Yeah. And so it had basically become so permeable that the particles that probably weren't digested or broken down were getting through and causing more inflammatory issues is kind of how I would explain it.
And it's causing inflammatory issues because it was being triggered. The bacteria release toxins. And so when the bacteria release toxins, now those toxins now wreak havoc on the whole system. And you start to feel bloated when you don't have the right balance of bacteria, because they excrete things like methane, right? Like in SIBO, we talk about that small intestinal bacterial overgrowth. One of the excretions is methane. And so methane gas, right? It's going to blow you up like a balloon. It's a wonder we don't, float up into the atmosphere. But but it's more of a signal. It's like that we have to do something because it could cause even more harm. I totally got off tangent with the babies, but going back to the newborns, so one of the things is coming out vaginally. Now, other things is breastfeeding. We just spoke about that too. And the benefits of that, the flora that you get from breastfeeding, you get the colostrum, which helps with the gut, right? And colostrum is only excreted. That's what I was saying in the first week, because colostrum is the first milk that comes in. It doesn't have like a major nutrient content, and you're like, how is a baby surviving? And that's why babies lose weight, because it doesn't have a high nutrient content. And that's okay if the babies lose weight. Part of it's like, they're swollen, they look like they're like a sponge. Babies are not very beautiful in the first week. And if anybody says, oh, your baby's so cute in the first week, you're like, okay, whatever. but then, our children are always the most beautiful in the world. Anyway, so what happens is, so the first week you have that colostrum, and it's just amazing for the gut, and it changes everything for the rest of your life. And then there's also different flora that you find in probiotics that you find within the milk of the mother versus a formula. And it's very hard to substitute that. But there are specific baby probiotics. We mentioned one for the colic, that specific strain, but there's probiotics which have many different strains that can help replace that bacteria. And so like I would if mothers are not nursing or just partially nursing, even, you want to make sure that they have a good baby probiotic. There's a few brands that I recommend. Like I think Zymogen makes a very, very good. That's one we gave. It's a powder, so you could put it right in the formula.
When would you start supplementing for that, for any baby for that matter?
Honestly, right away. Yeah, there's amounts that you put in, right? So like depending on weight, but you can start right away, 100%.
Would you recommend that with breastfeeding women as well, mothers as well?
That's a very good question. I would say like if they're having digestive issues, then yeah, for sure. And maybe the mother's microbiome is not fantastic. Sure. Maybe she was put on an antibiotic for strep B right before she gave birth. So like, and so her flora is not ideal. So yeah, so there's definitely cases which you would, and that would be like the third strike. So I always say there's 3 strikes on children, unfortunately, right? Vaginal birth, the breastfeeding, and getting antibiotics early on. You're destroying the flora, and very, very specific flora. Like the flora from a 1-year-old is not the same flora that you'll see in someone's 30. And it's not because they had experienced life and picked up things. Hey, that's part of it. But part of it is that some of them lessen. There's one, I think it's called Bifidobacterium animalis, if I'm not mistaken, and that's very predominant in babies under 2, in toddlers. And after that, it's not, your flora changes. So like throughout the ages, we need different flora. So it's not one probiotic fits all. It's so important for development, whether it's, I wouldn't call them simple things because they wreak havoc, but things like allergies and asthma and eczema. But those are the things that we see during childhood the most. But later on, those can develop into more serious things like autoimmune disorders. Because what is it with probiotics? You're just dysregulating the immune system for the most part. Right. That's it. It really is all about the immune system. If you can get the immune system to be level, there would never be disease. There would be no autoimmune disorders. There would be no cancer, right? There would even I think even neurodegenerative disorders, right, are linked to immune dysregulation. And
pathogens. It's now came out that viruses are actually a huge cause of MS.
Yes. Yes, absolutely. 100%.
Mm-hmm.
Yeah. Yeah.
So I'm thinking on like tools specifically. So for like eczema or anything to improve your immune system, let's say a new patient came in or a new person, what lab tests would you do? What things would you look at for starting that process for them? Or what things should they look to possibly start doing for themselves?
Let's give you an example to make it a little easier, but patients got gut pain, stomach pain, they're bloated, they feel like they can't get their diet down, they're probably eating not the most appropriate diet. Yeah. We'll call it the standard American. Let's say they're on the SAD diet.
Right.
And they're really just wanting to attack here.
Yeah.
But they probably also maybe have skin issues, like all the other things we know that's going to come with it.
Right.
How do you first kind of start that process with them?
Thank you, Doc.
I wouldn't necessarily do testing right away. Sure. And so a lot of practitioners would, right? There's a lot of functional medicine. It's a different approach. It's an approach they have because they want to like know what's going on right away and start fixing it. But if you can fix things through diet and lifestyle first, I end up doing testing typically anyways, most of the time, but you want to clean the slate, right? So if someone's on the SAD diet, the standard American diet, right? You know their flora is just awful, right? Guaranteed. And that's with any lab testing, right? I don't like to do lab testing right away. Let's kind of like, that's why I like to do a detox with patients first, fix some underlying stuff, and then do lab work. So let's say a person comes in, just honestly, fix their diet right away, right? Say, start eating like this, get rid of processed foods. Nothing major. I wouldn't necessarily put them, like for SIBO, right? You could put them on a low FODMAP diet, right? Those are like certain sugar alcohols that can cause bloating and bacterial overgrowth, which are normally actually very good for the gut because they promote the growth of bacteria, which is a good thing. But for people with overgrowth, it's not great. And a lot of times with bloating, you might find that Candida is another thing. But remove the things which cause those things, right? So like first, just eat a whole foods diet. Just, vegetables, fruits, just good sources of animal proteins, even like legumes. Like just don't limit them in any certain way, because like you want to limit, like let's say person's bloated, could be grains and legumes, but for now just start with the basics. You don't want to push someone overboard right away. Just kind of make substitutions. So you're like, instead of eating that just like junky white bread, let's get you eating like Ezekiel bread, right? It's like, it's got more nutrition, it's got good fibers in it, right? Simple things like that. Just get off the sugar. So let's substitute your bad oils for good oils, good fats, good sources of nutrition. Now, let's say that doesn't work. And let's say you even got them on an exercise plan. So they're moving, right? Because for gut motility, you need people to move. Like if you're going to eat well, but you're just sitting in the chair, you're not going to get good gut motility. Also, emotions is very important, the emotional aspect, because 90% of our serotonin is produced in the gut. Yeah. And so like serotonin is that happy neurotransmitter. It goes both ways. So if your gut's a mess, you're not going to produce enough serotonin, but it goes the other way. If you're not happy, if you don't produce enough serotonin, or if you don't have enough serotonin in your system, you're not going to have good gut motility. So like a lot of gut motility supplements actually have like 5-HTP in it, because they want to increase the serotonin levels to get the gut moving for gut motility. 5-HTP is a precursor to serotonin, 5-hydroxytryptophan. You want to get the gut moving in every single way you can. So, food, mood, and exercise, right? And sleep, and getting them to sleep at the right times, because, cortisol levels, and that causes stress, and then that causes inflammation. So you want to line up the diet and lifestyle stuff. Sure. So you do that for like a month. If they're still miserable, then there's two ways you can go. You can start eliminating things from the diet. That's one approach. So I think like doing like a food sensitivity test is a great thing to do. And so you can start eliminating. It doesn't mean they'll always be sensitive to those things. So there's allergy tests that we do in clinic. Allergies is full blown, right? Like that's what we call IgE testing, immunoglobulin E. And now there's food sensitivity testing, which is IgG. That's more sensitive. It's not a full-blown allergy. First of all, you want to do the allergy test. Just get rid of those full-blown allergies, because those are for sure wreaking havoc in the gut and causing bloating, causing a lot of other disorders too, but mostly because of the reaction in the gut that they're displaying as skin issues, joint pain, headaches, mood disorders, and so on and so forth. So that would be a good way to go. And so you eliminate those things. Now, as you eliminate those things, now you could do stool testing. Now, stool testing, you look at the actual microbiome of the stool. So you can look for bacteria, you could look for fungal species, you could look for parasites. The new tests actually test for viruses, so they test for some viruses like Epstein-Barr and some other ones. And
if you're actually fighting what you're eating in a way, right? Like gluten antibodies, stuff like that, right?
Correct. Yes, you definitely want to get gluten antibodies. Yes, and so like that tells you like gluten is not for you, because, and that's what celiac disease is when they find these antibodies, and you have to be eating gluten at the time though. So you can't, you stop gluten for 3 months and then get the antibodies test. It won't show up. You have to be eating the gluten at the time. You could get even, you go one step further for celiac, and there's actually genetic testing done, HLA DQ4 and DQ8. You can even go Quest, LabCorp, they offer that testing. It's there. Like, doctors can use that testing. It's available. It's on the list. But so you look for underlying things, and gluten is a big culprit. There's major foods. You can also, if a person's like, I don't know if I want to do the food allergy testing yet, food sensitivity testing, you can do an elimination diet. And so you can eliminate some major allergens and then bring them back in. So that's how I got inspired about the gut, is this book called Clean Gut by Dr. Alejandro Younger. And he has this diet, the Clean Gut diet, and he eliminates, like, let's say, dairy, grains for the most part, just because he's trying to rest the gut. But he's focused more because what grains that people typically eat is mostly wheat, because of bread and pasta. So he just stopped the grains. And then he eliminates processed sugars. So those are the major culprits, is like gluten, dairy, and sugar. Peanuts can also sometimes be a culprit for some people. That gets a little bit more specific. Soy sometimes. So you can do like an elimination diet and then bring one thing back at a time. And that's what we do for patients in our office. When we find an allergy, we have them eliminated for 3 weeks, and then we have them bring one food back at a time for 3 days at a time. Actually have them eat it for 3 days and then stop and then reintroduce the next food for 3 days. Yeah. And so you can say, it was that food. It had to be that. And so for the time being, stop eating that. But then you could do a stool test, right? And you look at the microbiome and you look at all these things, and then test like the GI map. You can test for antibodies for gluten. It's an awesome test. It looks for inflammation in the gut, secrets for IgA, so it looks at the immune system of the gut. So it looks at the enzymes. Sometimes we're not producing enough enzymes, and that's why we're bloated. Sometimes it's honestly as simple as that. But the microbiome can affect the enzymes. They kind of go together, but it's a great test. And a lot of times, the foods that patients were sensitive to before, now they're fine with it because you've kind of fixed the microbiome. Sometimes there's pathogenic bacteria that need to be eliminated. Sometimes it's just overgrowth of that bacteria, and you need to kind of pull things away that are supporting that, like a low FODMAP diet, maybe using a natural antimicrobial. So those are probably the steps I would take, is like, change the diet and lifestyle, just general healthy diet and lifestyle, then go a little bit more specific and eliminate foods. And then once you get the testing done, then you know how to approach it specifically. That's where you can address it with a specific diet and with supplements at the same time. You don't want to just do supplements. So like Candida, you want to be on the Candida diet. Meanwhile, the same Candida diet may not be good for someone who has a low microbiome or SIBO, because with the Candida diet, you're eating typically like lots of animal protein and vegetables and no fruit. You don't even eat fruit for the most part, at least eliminating like the high glycemic fruits. And that's your diet for the Candida diet, because you don't want to feed the fungus. You want to eliminate anything that feeds the fungus. And then, but that would not necessarily be a good diet for someone with a low microbiome, right? For that person, you want to have them to have a lot of grains and legumes and fruits, because you want to nourish that flora. So it's a totally different approach. I know a lot of people talk about the carnivore diet now, and that works very well for people who probably had or have SIBO, have some overgrowth, and so it works very well for them because you're not feeding that anymore. But for someone who has the opposite, it could be very detrimental. Yeah.
Which is why I think many patients should seek a professional first before going on a diet. Again, they're probably going to get better outcomes, and they won't start out with a diet that might be more harmful than helpful. Yeah. In a way.
Mm-hmm. Exactly. They'll know exactly how to approach it, and it's cost-friendly too. It's less stress. It's just like knowing. Yes, the stool testing can cost over $300, but I've seen patients bury so much money.
What does diverticulitis, all the other things cost when you start continuing down that path of not getting this taken care of, right? cholecystectomy, or what does that cost, right?
Yeah, and you can't go back.
No,
Back from that.
no.
Yeah.
But yeah, no. Doc, is there anything else you want?
Dr. Google.
Yeah.
Dr. Google and wasting time.
Wasting time.
And then just stuff adds up, kind of like what you guys were saying. I know since we're on the topic of the gut, we were talking previously on how cardiovascular health ties into gut. When we first go into some of those conversations, I never even thought about those two even connecting myself, even as a provider. But how do those two connect?
I would think of two things in connection. So directly, when the microbiome is altered, right, you cause more of an inflammatory response. So going back to like even the cholesterol discussion. So what do doctors concentrate on is all like cholesterol, right? Meanwhile, what they should be focusing on is epithelial damage, is damage of the blood vessel lining. That's why a person gets a heart attack, is because the blood vessel gets damaged and now the body tries to repair it and now starts to put cholesterol as patches. And then you get calcium buildup on top of there, right? So that's why it really happens. And so it's an inflammatory response. And so if you would have more antioxidant potential, and therefore the blood vessels now get clean, all of a sudden, it's just, the cholesterol melts away. The cholesterol doesn't want to stick to something which is repaired. It's slick, it's smooth. The blood vessels are moving, they're dilating. So that has a lot to do with it. And then, if you get a little bit more specific, let's say into autoimmune disorders, psoriatic arthritis, rheumatoid arthritis, fibromyalgia even, those things have an effect on the cardiac health. Why? Because they start to damage tissue. We always think about rheumatoid arthritis, psoriatic arthritis as it's just a joint disease. No, it's a lot more than that. It actually damages soft tissue too. And people with rheumatoid arthritis, psoriatic arthritis, I think even fibromyalgia, they are more likely to have cardiac issues because of that inflammatory response, and it causes direct damage to the heart. Now there's something else which is linked, like specifically, let's say, to red meat. It's like kind of a separate thing, not necessarily a microbiome thing, but it's known that with the consumption of red meat, it increases something called TMAO. It's an enzyme, and basically they've found that when that is elevated, it's correlated with an increase in cardiovascular disease. Okay. So it's actually a marker. Like homocysteine is a marker too. C-reactive protein is a marker. Yeah. It's not necessarily like that thing is causing, the cardiac damage, cardiovascular damage. It just happens that marker shows up with red meat. Sure. So the question always is it that marker shows up? And we know with TMAO, because TMAO can rise with other things, right? If someone has a high sugar diet, it can also rise. If someone just has an inflammatory lifestyle, that marker can rise. It doesn't matter, but isn't necessarily true that the red meat is directly causing that because the marker's high. I'm not sure about that. I know it's hard to know the links, but it has been an established link in terms of, like, let's say cardiovascular health. We talk about gut health and liver health. So when you eat certain foods, it's not, they always talk about how it raises cholesterol, but it's much more than that. Why? Because let's talk about the liver first. So if you're eating inflammatory foods, whether it's bad oils, whether it's processed sugars, they're going to cause a major burden to the liver. Red meats, right? Overconsumption of red meat causes a burden on the liver, causes a burden on the pancreas, affects the microbiome of the gut. So is it really the cholesterol from the meat that does it? No, because our liver processes cholesterol. That's what creates cholesterol. It's not like I consume cholesterol and then it goes to my arteries. It's our liver has to process it.
Isn't like 90% of our cholesterol created in the liver? Yeah. We don't actually get a large amount of it from our diet anyway.
It's not from dietary consumption. Right. So let's say you eat good sources. Let's say you have grass-fed meat, which is necessary for processes in the body. We'll talk about mitochondria soon, I think. But you need L-carnitine. A vegan does not get L-carnitine, And if you don't have L-carnitine, you can't process fats in the body. And so you can't process fats in the body. Guess what happens? You get deposits of cholesterol in the arteries. So, you could go on and on and on, but they're looking at like such a simplistic way when medicine is so much more complicated. There's so many biochemical pathways, and that's more important. So going back to the gut, so we know that there's relationships in terms of inflammation, inflammatory pathways, inflammatory diseases, but metabolic disorders are linked to gut health, right? We know that specific bacteria can actually help us lose weight, can help us process sugars better, it can help us process fats better. So it's so important. If you don't have the right pH, right, the right acid balance in your stomach, it's mostly not enough acid. Typically, let's say with acid reflux, people think it's too much. In some cases it is, but in most cases it's not enough acid. So if you don't have the right pH, guess what? The pancreas is not going to release the enzymes it needs to break down the food it needs. You don't get the right nutrition. You don't get the fats broken down. Then they get reabsorbed, and you start to collect fat. I mean, you can go down this rabbit hole, but it's not so simple. It's like, okay, you have too much cholesterol in your arteries. Now let's take all the cholesterol out of your diet. You're taking a lot of my nutrients out of my diet also, which are preventing me from heart disease. So I don't think one camp or the other is necessarily totally right. I don't think, totally vegan, totally carnivore. There's this fine balance, and everyone needs certain things, but you have to make sure at least to get the nutritional balance. And it's not just about macros. The micronutrients are very important, and phytonutrients. And so, and there are certain phytonutrients that are just found in vegetables or fruits, like organ meats. If you're doing carnivore, you have to do organ meats because you need to get your vitamins and your minerals, right? So there are some phytonutrients in the organ meats, but there are things that you need from fruits and vegetables, which you're just not going to get from animal protein. But vice versa, like if you're a vegan, you're missing out on a lot of things, right? You're missing out phosphatidylcholine, which helps you process fats in the liver. People, you can get, you think, oh, I'm vegan, I'm never going to get a gallstone. You can definitely get a gallstone because you don't have enough choline. So you're not processing the bile properly. Sure. But then they say, do a low-fat, high-carb vegan diet. Oh, that's really great for your hormones and your brain. It's just everyone, they jump onto this bandwagon and they get so caught up.
It's almost like all or none, right? Yeah. Like there's no moderation. They're just like, okay, you're about to die, let's switch you to the other side. They almost don't know how to take it up at a level that's appropriate for all systems involved. They're just kind of tunnel visioned in a way.
And very much. It was never like that. I mean, throughout the ages, everyone kind of ate similar. Cultures ate similar. It's not like, I'm going on this diet, right? Like you have an Italian and they're like, you know what? I'm going to eliminate pasta from my diet. It's not happening. So it's, then that's another story.
But Italy is one of the healthiest countries on this planet. So obviously that's not as correlative as people think.
Right. Like a lot of the blue zones, right? The blue zones are typically more plant-based. Yeah. Do they eliminate animal protein completely? No, definitely not. And that's where like a lot of the vegan doctors, the authors, they like concentrate on these blue zones. They're like, look at this. They don't eat so much meat, so we shouldn't eat any at all. No, Italians and they eat a lot of fat. They use a lot of olive oil. Yeah. They do have dairy. They do have meat. Moderation, though. Keyword is moderation. Asian diet, like yes, predominantly they eat. Let's say in Japan, in the villages of Japan, like the Okinawan diet. T. Colin Campbell, and he wrote the book The China Study, and he's a vegan, and he's espousing like what they eat, but he forgets that they eat fish too. Like, and they do eat eggs. Yep. Like they'll have one egg. Sure. And so they cherry pick from a lot of these studies, and it's just wrong. Like you have to look at the totality of things. So even as natural practitioners, like we get carried away too. We have our agendas, and so we have to stay balanced too.
Yeah. That's beautiful. That was really beautiful.
And I absolutely love that. Going off of the certain areas in the world in terms of even just life expectancy, we're at, I think in the last few years that life expectancy has now decreased.
For sure.
Which is fascinating in itself. But in terms of when you look at a patient or just even our general population, where do you see the life expectancy going for not only just America, but also the whole world? And is there certain things that you feel like we should look at to improve the life expectancy for the longevity?
Yeah, I think like the main thing is that technology was supposed to help us, right? It was supposed to make our life easier so we wouldn't have to work so hard, but we've used it instead for making more money. The way we think is like this, and I see this on the way home at the Chick-fil-A drive-thru. So why are there so many people at the Chick-fil-A drive-thru on the way home from work? Is it because they really love Chick-fil-A? No, because they figure like this. They're like, in that hour, I could be making, let's say, $30. Instead of standing in the kitchen for an hour and preparing the food, which I make nothing. So I'll go to Chick-fil-A, I'll spend, I don't know, with inflation, I don't know, it's pretty but even let's say it's $15 for a meal. Let's say, to be generous, $15. But the thing is, if you look at the difference, now they've made $15. So the thing is with technology, because you have technology, you have this convenience factor. Yeah. And so with this convenience factor, you can now work longer hours and make more money and have benefits from not having to stand in the kitchen. Right. That's I would say that's number one. Number two is that because we have technology, and let's say our work is done sooner, now what we do is we tend to, let's say, work harder during those hours, and then once we get to relaxing, we don't necessarily want to put that effort into preparing the food. We want to really relax. We work so hard, we've earned this convenient meal. We earned this fun meal, yeah. And so now with that, you reach a place where a person's more unhealthy. Also, it used to be that, and I think this is the majorly direct effect, is that with technology, we've created these foods. We've created like a box of cereal. We've created processed foods. And so we don't have to use basic ingredients anymore and put it together ourselves. With technology, it's made it very cheap, because technology always is a deflationary thing, and it makes food cheap. So while it used to cost a lot more to, let's say, eat out, now it costs less because our wages are higher than that. And also it could cost more to use whole food ingredients because we have to stand in the kitchen and spend more time. And also it's become so cheap to make like the processed foods. It would have been much more expensive, but because of technology, because machines make it, it's become a lot less expensive. And it costed not just to stand in the kitchen, but remember, we used to have to reap our harvest. Yeah. So that's one of the factors of longevity. Let's say when they look at the blue zones, yes, it's a lot about diet, 100%, but it's also a lifestyle, because they are out there plowing the fields. Yeah. They're out there reaping the harvest. You know, it's very, very different. They may not do like your classic exercise. So like, and this goes back to the idea of like, we think that like, okay, we worked all day. We sat in our chair all day at the office. If we go to the gym, right, every couple days, and we go to the gym and we go for an hour a day, what's better? In terms of longevity, what have they seen was more beneficial? Being out in the fields, working moderately, right? You're working hard, but you're not deadlifting. You're just, you're lifting baskets and you're bending down 1,000 times, and that increased longevity versus, all the studies show it, versus, let's say, someone who went to the gym, say even 5 days a week for an hour at a time. Why? Because they were stagnant. Yeah. for 9 hours sitting in their seats. And then also you're eating processed foods. So whether it's takeout or microwave or something, it's easier. I can spend more time at work. I could spend more time doing the things I enjoy because I deserve it, because I work so hard. So I think technology has really bit us in the butt. So now there's good ways to use technology for longevity. I mean, in terms of basics, and then advancements like you were talking about earlier with stem cells. But just in the basic level for the average person is that it's just a mindset shift. It's like, what should we do? Now that we have technology, right, and our life is a lot easier, so we can, let's say, make a passive income without having to work so hard. Now that we've done that, we have to have the mindset shift to say, now it's allowed us more time to do the things to get back to nature, to take a hike, to spend time with your family, to cook with your family. If you have a backyard, start a garden. It doesn't necessarily have to be like I have to grind in the gym, but you can spend more time, where you don't need to make as much money. People only make more because they have a higher standard of living. But we have to, it's a kind of a mindset shift. I was watching this video of like they were interviewing older people, like, what do you regret from earlier on? It's like, and the main answer was, I wish I wouldn't have concentrated so much on money. I wish I would have concentrated on having peace in my life. So if you can like cut back your hours and concentrate more on and taking those hours and actually living life and not having, I don't need to go on this major vacation because I'm so stressed out. What if you just on a daily basis weren't so stressed out and just worked less, and didn't put your focus so much on work, instead focused more on eating well, spending time with family, just relaxing. And I think that's how we can use technology, by making our lives easier. That was the whole intent. We didn't have to wash our clothes anymore. Now we don't have to wash our clothes. Now we can spend more time doing the things we want to do. But instead, we've substituted with working. Now that I don't have to do laundry, now I can work more to make more money to pay for my cruise because I'm so stressed out because I work so hard. So I think that's where longevity comes in, and that's where the blue zones have never changed. Even here in America, the only blue zone here in America is Loma Linda, California. But they're Seventh-day Adventists. But people think, it's only because they're vegetarian, which is, I think there's something to it. They eat, a lot of fruits and vegetables, moderate amount of animal protein, which is very important. But a big thing with Seventh-day Adventists is, guess what? They take one day of rest. I mean, we do too, right? And that's how they're very similar to us. They actually take it the same day they take it on Saturday too. But they take one day of rest. Do you know what that does for your stress level? Like, you can't use technology. Mormons are also on Sundays, they're doing no technology, nothing worldly, and spend time with family. Even having that one day changes your whole week. It changes your dopamine levels. It changes your cortisol levels, which have so much to do with health, and you don't gain as much weight, so you're not, the obesity, and then cardiovascular disease, and it throws off your gut flora. And just going back to all the discussions we've had, just by doing simple things, they're just more relaxed. In Italy is another, it's unbelievable. It's like, and they drink wine, and they eat a lot of olive oil. So you would think, that's not necessarily healthy, a lot of fats and alcohol. They don't overdo it, but they, they'll have a glass of wine with their meal every night, but they eat with family, they talk, they laugh. They're not sitting in front of, they're like, we didn't prepare the meal so we could get the meal done faster so we can sit in front of the TV and watch as we're eating, right? It's like, it's such a different lifestyle. Part of the process, our food, I think, and I'm just thinking about Italy, and I know I'm just like going off on tangents here, but our food, the way we make our food, technology has allowed us, let's say with wheat, let's go very specific with wheat. It's allowed us to hybridize the wheat to get higher gluten content. The higher gluten content, you get higher satiety, right? You feel fuller.
Farmers make more money too.
farmers make more money. Yes, 100%. And so it works well because you need a certain content. If you have a higher protein content, certain macros, you make more money. If you fatten up your cows, you have higher fat content and, in the milk and stuff. Yeah, you make more money. So that's definitely a huge part of it. But what's done that? Technology has done that. Yeah. And so, now we're able to feed people cheaper. But in Italy, all of a sudden you can eat their wheat. People that are gluten sensitive, gluten intolerant here in America, I had it with patients all the time. They go overseas to Europe. They eat pasta. They eat bread. They go to town. Nothing. No digestive issues. Yeah. They feel great. They don't feel sluggish because gluten can give you fatigue. Nothing. I had this one patient. This is awesome. She's in her mid-40s. She was starting to have perimenopausal symptoms, starting to have hot flashes, and fatigue, digestive issues. So she had a very strict diet. She's on a supplement regimen. She didn't want to take hormones, so got her on some supplements, some herbal supplements like black cohosh and Vitex, and it helped. It helped, regulate her hormones, and she felt better. But she knew she could feel even better than that. But I told him if you would be on the hormones, you would probably feel a lot better. But she didn't want to do it. But she had to stay away from gluten. Gluten was a no-no. She would not drink wine. All of a sudden, she went on a 2-week vacation, and she got back, and I was, we were going over the lab work and everything. I'm like, oh, how's your vacation? She's like, I felt amazing. I'm like, oh, the supplements. I guess the supplements started kicking in and stuff. She's like, I didn't bring my supplements with me, and I'm like, tell me. She's like, I ate so much gluten. I ate dairy, and I drank wine. And I felt great. I had energy. I didn't have any digestive issues. Right. My hot flashes went away. Wow. And I'm like, what? But it's, what? It's not a surprise because she was more relaxed. Yep. She was eating the hybridized wheat, right, with the lower gluten content and higher nutritional content. She was eating real food, unadulterated. In Europe, they have a lot more regulations than we do with food. Cosmetics, forget about it. 3/4 of the products we use in the supermarket, they're banned in Europe, and that causes so many chronic illnesses on its own. But it's a different life. Why we're the most advanced country in the world, and going to life expectancy, why has it been going down? I think in the past couple years it's ticked up. Okay. And I think it's because of the semaglutides. I think it's also because people are working from home. And I think people they're just happier. And also COVID taught them a lot. People stayed home with their family. And so the mindset is shifting. They're like, I loved it. I loved being home with my family. And so I think things are shifting in the right direction for sure. And going back to medications, it's all about covering things up. So let's say with a statin, if you take a statin, are you guaranteed to not have a heart attack? 100% not. If you have lower cholesterol, are you not guaranteed to have a heart attack? No. So they're addressing the cholesterol, but they're forgetting to address underlying issues. And so let's say I would say more the old glucose medications like the sulfonylureas, they help lower the blood sugar. Metformin's a little bit different because metformin is an AMPK activator, so it actually helps the mitochondria. So there's other benefits. So actually metformin helps with life expectancy. But let's just say you're concentrating on lowering sugars. Let's just say insulin, right? Yeah. They're not addressing the elephant in the room. They're just looking at one number at the surface, but they're missing the boat. They're missing the gut. They're missing inflammation. They're missing liver dysfunction. You pay attention to those, the disease goes away. Yeah. Right? So, yes, technology has given us all these drugs, but people use it as an excuse. I think Kelly, our other PA, was telling me this story. I think she did one of the rotations with an endocrinologist, and endocrinologist gave the person, had the person on insulin, and I think they were also started doing semaglutides at that point. And the patient's like, oh, should I now adjust my diet? They're like, no, you can eat whatever you want. It's okay. And the doctor himself was like, no, wasn't in great shape. She told me he had like a beer belly, and so basically, yes, you're addressing that lab value, and you can't do that with supplements either. I think people make that mistake also. They always they're like, oh, I need something for blood sugar, right? I need something for my cortisol levels, and they're not doing the foundational stuff. You have to get to the foundation. Technology is great, but I think it's definitely has been more detrimental than helpful, just because we're human beings and because that's how we'll act on it. We to increase longevity, to increase life expectancy, we have just get back to the roots. You see how people can live long. Right. Now let's capitalize on that. Let's start from there. Let's live a lifestyle where we're relaxed, where we're eating well, real food. And then after that, now let's go into advancements. Let's get our bodies where they're not even breaking down. Right. Let's add on peptides. Let's add on stem cells. And that's a nice bonus. And not allowing tissue breakdown. We're going to use nanobots, and they're going to be repairing things, and the Neuralink like you talked about, and that's going to help repair, the nervous system. So yeah, you don't need to do much to be healthy. You need to make sure you don't get, and that's another thing with technology is all the fumes and toxins and stuff, that pollution that's put out. But get rid of toxins, get your nutrients, and get communication. And that's in chiropractic, that's what you're doing. You're stimulating, the nervous pathways, because you need to tell the body what to do. And, it's very simple. It's not rocket science. We don't need the technology.
But you can't sell that, unfortunately.
It's hard to.
You know what I mean? And that's where people, unfortunately, they think drugs and supplements are a substitute for poor habits. Yeah. But the doctor also can't sell you a habit. Yeah. And that's where they're going to continue to chase things that they can sell, unfortunately. And if only we kind of, in a way, can sell a lifestyle, and we can coach you through that. Yeah. But too many people think that they don't need help to change a habit or a lifestyle. Right. Because they're like, well, I can just do that myself. Yeah. But they never do. And I think it's funny that they have that almost subconscious thought of, well, I don't want to just go to someone and then pay them to teach me how to eat healthy. I can just do that myself. But right. 99 times out of 100, they just never do that.
Definitely not.
Right. Yeah. And I think it's funny.
You have to be motivated. Right. I think everybody has their thing that they need a coach for. Mm-hmm. So if sometimes people have issues, with eating healthy, they need a nutritional coach. Yeah. But then there's people that eat well, but they need an exercise coach because they can't pick themselves up, and they're like, I know what to do. Like I can do it. Emotional health, they're like, I can figure this out on my own, right? I can read a book, a self-help book, and go see counseling. Yeah. Mental health is so important. And people think, oh, I'll just do yoga and I'll be in great shape. And I think that's very important, but there's things that throw our spine off. So, and you need someone from the outside to adjust it.
I can only imagine what someone who hasn't done any movement in 20 years doing a session of yoga is going to feel like. Right. They think they can just breeze through an hour of yoga, not to know what they're going to feel like after that,
Right. Yeah, and that's discouraging. It's like, oh, man, I can't do this. It's not for me. Mm-hmm. Exactly. And so you need that help to get back there. And our clinic does that. It's like a snowball effect. It's like you fix one thing, and then they're motivated to do the next thing, and then the next thing, and then all of a sudden they're getting off medications, and it's so cool to see that.
It is.
Oh, gosh.
I love that.
And I think that the cool part is that we kind of already built into the systems, I know with our clinic, is going back to the vision aspect. Yes, it's hard to change people's perspective and their mental, physical state when they first come in, or when they want to even start their journey, or they try something, doesn't work. They want to try another thing, doesn't work, and that persistence. I think this is where we found a huge trend. If you change their emotional state, and if you can put them into a state to where they can envision themselves in their happiest state or their happiest memory, and then asking the questions, okay, awesome. stay right there. I mean, if you have to close your eyes, perfect. What is your mental mindset? Are you happy? Are you sad? Are you excited? Okay, so let's add that to the equation. Okay, are you moving? Are you enjoying time with others? Put that to the equation. Just that mental state will automatically start, one, for the memory, to get the brain under control, and then two, it's going to help start the processes throughout the body. Yes. You hook them to that and you keep reminding them of that. I think that starts the whole cycle from there. And I really like how our clinic has apted towards that philosophy and movement, but it all ties into like everything we're talking about today. So it's unique.
Yes.
You need to manifest that thought because they've been geared for so long to think that whatever trajectory they're on, that's the trajectory they're going to remain on. And it's not true. You can do something different. You can change. There is hope. You just have to do something different. You can't just keep doing the same thing that you've always been doing. You have to reprogram the brain. And that's pretty cool that we do that here. We help them see what they're going to be able to do, and it gets them excited. And they're living it now. They could see themselves doing it now. It's not like, oh, it's going to be a hard journey and I don't even know if this is going to work. They see themselves being able to do it now, and it's just a little bit easier for them to do it. So they start doing the things that they've always wanted to do. They're not waiting for tomorrow.
I think one of the ways we get them there is trying to get and because of course you talk technology, right? We're now used to instant gratification. Right. And we have that built into us now. Yeah. And so as practitioners, we've all known how quickly we get results makes a difference if patients want to stick to care or not. And what's cool is we've been able to have the laser in office now. And it does do that exactly. I don't know how many patients you've told us about where you did a session, even just one session on them, and they had such a drastic change that they never had for years. And I think that can then motivate them to be like, oh, wow, this is what it feels like to actually have a shoulder that moves like this that I've never actually had for years. So I guess that's my segue into, you talk a lot about just how much you've used your laser for so many different things, but just on the basis of that, we were going to finally finish off with just the mitochondria, and I think the laser will obviously tie a lot into that. But where do you see the bridge of the laser to the cellular level, and how does that actually impact mitochondria, let alone other cell processes in the body?
Yeah. Like we spoke about, like mitochondria is the powerhouse of the cell, right? That's what produces, for the most part, like we have also the Krebs cycle, but most of our ATP, most of our energy is produced from electrons crossing across the mitochondrial membrane. Now, you say, okay, so that's energy, so I'm going to feel more awake. No, it's not just about not feeling fatigued and having energy to get up and go. That's not what mitochondria is about. Mitochondria is energy for the cell, so the cell cannot repair itself. It cannot undergo DNA repair without the mitochondria being in optimal state. That's why we see, like if you go to an extreme case, people with genetic disorders of the mitochondria, they age a lot quicker. They'll get gray hair very early on in life, wrinkles, all that stuff. Obviously, die younger. But yeah, so it's not very common, it's rare, but there's mitochondrial disorders. I think it's from the mother. Now, using that extreme case, imagine if you optimize the mitochondria. Now, you have a much more youthful cell, because what happens is when the laser triggers the mitochondria, it stimulates the mitochondria. On the mitochondria, there's different receptors. And when those receptors are signaled, now they create a chemical pathway. Now, that's called photobiomodulation.
The act of the laser creating the biomodulation.
Yeah. Exactly. So the photons from the laser now stimulate the electron transport chain on the mitochondria. Now, you have different parts of the electron transport chain where different wavelengths of light can affect those parts of the mitochondria. And you stimulate those, all of a sudden you get optimal ATP production. You get optimal ATP production, all of a sudden you're in less pain because it affects the nociceptor, so you're in less pain. It causes the muscles to relax, so the patient gets better range of motion. So those are the two main things that people get right away, but long term, you can actually heal, right? You can heal the tissue, heal the nerves, heal the musculature. Bone can heal quicker. Actually, the rep that we know. So she told me that her son had a broken bone. I'm trying to remember if I think it was humerus or the femur. It was a major bone, and the doctor was in shock that it healed so quick because she used the laser on it on the frequency, because you need to set it. The laser is not just simple. It's not just a flashlight. You turn it on to a red light or violet light. Like, you need to use a specific frequency because you're trying to get a certain amount of joules. You need to get a certain amount of energy to that area, and that's what they've seen with certain things. It can heal bone. It can help with acute pain. It can help with, and we can go even further, but in our clinic we mostly address those things, like the chronic pain. Zirconia is the laser that we use, and they've done studies themselves, but any type of laser, now we're talking about LED, we're actually talking about actual laser. So they found with like the low level laser therapy specifically over LED therapy that they found not just with zirconia, but not intercorporate research, but even outside of that, there's thousands of studies. They've done like 20 studies of their own that are published, but there's I think over 1,000 studies that are published on low level laser therapy, mostly on chronic pain, whether a lot of neck and shoulder pain, but also lower back pain, but just the results, even compared, and zirconia does a lot of research compared to what they call the sham therapy. So they actually use like LEDs, like, the LED panels that you'll find like on Amazon. So they've compared to those, and those were effective, but the laser just blew it away. The results were way better. It's a more expensive tool. It's only available to practitioners, while you can go on Amazon. And there are great LED panels, and there's definitely, I do recommend it to patients, where they can use it at home, like on an everyday basis. But the laser just, the effects that it has, like even after one visit, is unbelievable. And even like compared to other therapies, and we do trigger point injection therapy, which is very helpful at loosening up the tissue and allowing the tissue to relax, reducing pain because you're targeting the pain receptors. So, and very similar to massage, we get a little bit deeper with the trigger point injections, so we can actually get into the trigger point itself and help it release and break up the fibrotic tissue, and the injection itself can help with the pain and the inflammation, and along with the massage. But in terms of like immediate results, the laser has been incredible. Where I've seen it the most was with frozen shoulder. Okay. And where, we've had patients where we were doing trigger point injections with them for like months, 3-4 months. Yeah. And yes, there was definitely an improvement, 100%. They were in less pain, they had better range of motion. But a lot of times they were returning, like we would get them to where they needed to be, and then like a couple visits later, especially when the visits become less frequent, they were kind of like they were starting to stiffen up again. With the laser on the frozen shoulder, it was just unreal. It's like we were able to get full range of motion within a 10-minute treatment, using one laser has green and violet, and one has red, two red diodes. And so just working like around the scapula, working around the glenohumeral joint, and just the rhomboid and the musculature around the rhomboids and around serratus and the rotator cuff tendons, and just 10-minute treatment. It's unbelievable, full range of motion. And then the amazing thing was, like, I remember one patient we had, she came in 2 weeks later, and typically when it was that infrequent, that it would kind of go back to its original position. She still had full range of motion and less pain. And
that can take months to years for some patients to have frozen shoulder to achieve that. That's what blows me away. Yeah. Is just not only how quickly the results happen, but then getting to keep those results too. Anybody can take an arm and stretch it and make it painful, and it'll be better. Right. But to do it without even, I mean, it's so safe and pain-free. You don't even feel the laser.
And that's the amazing thing. It's like, I remember with that patient, she was doing it on her own. I wasn't pushing her arm. She was doing it all on her own. Sometimes I'll have them do it on their own. I don't like to push. One thing I learned is like, because they'll be too sore the next visit, so I don't like to force. They tell you sometimes in the protocols with the laser to like go from passive and then go into active range of motion. But I'd rather the patient do it themselves, and I'll have them, because they know their pain scale. So once they can get their, let's say their arm behind them, now they can pull it and even pull it up with their other hands. And people think it's like hocus pocus. They're like, they always say, what kind of magic is this? But then I'll break it down scientifically for them, not in too much detail, but in layman's terms, like you stimulate the mitochondria, you produce more ATP because different wavelengths of light, and they have to be very focused. They can't just be like red LED where they're incoherent. You have to have the coherence, and where the wavelengths always remains the same. With LEDs, the newer LEDs are better, but typically because the light spreads out, they tend to have different wavelengths. So are they effective? Yes, but not as effective as like a focused coherence laser.
And you would say most Amazon lasers are the LED ones?
Yeah,
probably.
LED.
Yeah, very rarely are you going to get a very high-priced and effective coherent laser on Amazon. You probably just very rarely would find that.
Yeah, I mean, an LED panel, let's say, costs around $200 on Amazon, right? It's, let's say a foot tall, 6 inches wide is like about $200. The red laser is $10,000, and the green and violet laser is $18,000.
So what's the difference between the colors? Because I'm sure other people have questions on it.
Very good question. So the original one was the red. Everyone knows about the red, and that's the question I get. Oh, is this like red light therapy? So I said I do have a red, and the red is very good for inflammation, and it's also good for they found with some neurodegenerative disorders, because we always talk about like how you can use it on the brain too, and so the red is very helpful. But then they found that the green was like for chronic pain was even better. So the red is helpful, and the red works well, even using the red alone. But the green, when they did their studies, the green reduced pain quicker. It was more efficient. And then the violet is pretty remarkable. Violet is more antimicrobial. It's a very high energy laser, but it's very much antimicrobial. So it's very good for skin conditions. So things just like acne it could be helpful on. But really any sort of skin condition that, if a person has a wound, right, you could get the wound to heal quicker with the violet light on its own.
I know there's a lot of application for weight loss too with some lasers, right?
Yeah, and that's what I love about the laser, because everything is non-invasive, and the person doesn't really feel anything. The most they'll feel is like a little bit of warmth, and it's not like, oh, that's burning. Nothing. No, it's just like, oh, it's a nice warm feeling. They always tell me like, oh, that feels good, but it emulsifies the fat. So they have the red. There's the red one, which is very effective, and now they found that the green is even more effective. Don't even get me started about the prices for that one, because there are multiple diodes. They're like 6 or 7 lasers, but it emulsifies the fat. It just melts away the fat, and patients. I think you have experience with like. Like people can lose like 4 or 5 pounds after the first session.
So what we were told is no matter what patient you see, there's always usually a circumference reduction. Yeah. And to this day, I still have yet to never see someone not get some type of reduction doing a 20-minute session with the laser. And I've heard that there are times where I think one of the most they've seen is like a 16 centimeter reduction around the waistline. And now this patient was, very obese. Yeah. So there was a lot of fat to shrink, we'll say. But for those of you that don't know what a 16 centimeter reduction is, if you go on to a tape measure and look at what 16 centimeters is, that's about, in inches, is about 2.5 inches per how many centimeters?
2.5 centimeters per inch.
There we go. So that's, we're talking, is that about 8 inches? 8 inches off of a pant. I can assure you anyone is going to want that before a wedding or fitting into something that's needed. Yeah.
It's unreal.
And it's not an unhealthy weight loss. Like you're just moving the fat deposits. You want to do like a lymph drainage sort of thing with that. Take certain supplements to help with the lymph, get some lymph drainage done too. but it's never like, you don't have these unhealthy side effects like you do with like liposuction, obviously, you know, with surgery, even like the freezing, they freeze the fat. And then sometimes with like these crash diets, they can destroy the gallbladder. So like, you don't have any of that. It's slow. Your body processes the fat, and it's remarkable. The laser just does so much, and it's that the uses are endless. But it's funny that you talk. So in our practice, I'm actually using it on one patient. I don't know if she told you, but for a lipoma, and her husband, even after the first treatment, she said that it shrunk. Yeah, so we did a second treatment.
And so for those of you listening, lipoma is just a pocket of fat tissue.
That's right.
And you're saying it reduced in size.
Yeah. Like the husband noticed like it reduced in size.
And I bet some of you even have it, you may not even know. You might feel it, it's kind of rubbery and movable, and you might have them on your body. That's crazy.
Yeah. That's crazy. Yeah, and if they're big enough, like they kind of require surgery. Like it's hard to get rid of them, but yeah, it's amazing.
So I know there's going to be questions. Does insurance cover this? Where do you find these lasers? Is it FDA approved?
Yeah.
Where are we at right now with that?
Yeah. So insurance does not cover the laser. It should. I mean, it's non-invasive. People get results. It would cost insurance companies that much money, you know, and to get out of pain, like people could go back to work sooner. So it would save the country money, workman's comp, and just other bills and going to get medications. And yeah, so insurance should cover it. Less surgeries, right? And it would actually benefit the insurance companies. Can you imagine if insurance companies didn't have to pay for surgeries? But it goes along with chiropractic too. So I think it'll happen. Now chiropractic is covered under most insurances. So hopefully one day they'll wake up. But for now, it's out of pocket. FDA has approved certain lasers from Marconia for specific uses. So it's the only FDA approved laser for chronic pain. I think Marconia.
And I think they have 23 of the 24 FDA cleared. It's something to that, right?
That's right, yes.
Oh my
Like
goodness.
they legit have almost all of them.
Yeah.
For all their lasers.
Yeah.
They pretty much have circled the map on clearances.
Yeah.
It is one of the safe, if not the most safest treatment according to the FDA, right? Which, I mean,
For sure, they could shut that down easily because they're like it helps too much, or we're shutting this down, and they can't because there's no side effects, and people are just getting better, and it's pretty remarkable, like that they have 23 of the 24 FDA approvals. So chronic pain is one of them. I know they have the specific laser for fat loss, and then they have one for. This is another thing. This is where the violet comes in as being antimicrobial, is that it actually kills fungus. So they actually have one that's red and violet. If I could use it with the handhelds, I could use it red and the violet. I've actually been using it myself. It's been helping. But you have to be consistent with it, but because that's pretty stubborn. But nail fungus, they have FDA approval, FDA clearance for that too, for podiatrist use. They won't allow me to get. I actually asked them like if I could buy this. They're like, because I would love to buy it for myself. They're like, no, only podiatrists have access to this. Right? Yeah, that's at least what they told me.
We'll have to find a podiatrist who'll buy it for us.
God. Yeah, that's it.
Right.
That's it. We have to find podiatrists. But so it's pretty remarkable. There's frequencies that are programmed that you could program the laser for many other different things. Hopefully it'll get approved for other things. We know a case of kidney stones that got broken up.
Yeah, my mother. That was crazy.
Yeah,
so my mom had kidney stones hurting pretty bad. We took an x-ray. It was still in the bottom. For her, it was bottom left quadrant. After a session with Josh's laser, I think it was within 24, 48 hours, and it was seamless. Like, she didn't have any pain. She saw the stone came out, but it was not painful at all, which is incredible.
Yeah.
Never even
Those suck
thought
too.
about that.
yeah.
For those who've had them, they suck.
They suck, and the treatment sucks even worse. Lithotripsy, it causes bleeding and pain. It's not fun. So just do it in a non-invasive way. That's awesome that she was helped like so quickly. She had relief, and like it was seamless, like you said. And it was one treatment. I think it was 15 minutes. We put on the kidney stone frequency, and just like that, we've done I think everybody's sinuses in the clinic. Like they had sinus congestion, and that like in 5 minutes, put the frequency on for that.
People won't believe it.
Yeah.
Like that's the hardest part is it sounds like what everyone's been waiting for. It's like, can you get this done today? Yeah, we can. I mean, it won't fix you, but it will give you that relief you're looking for, and it will give you the change you're searching for.
Here at AFC, with the chiropractic and the PT and the corrective exercises, we can get them relief. We always talk about imbibition. If you get the joints moving again, then it can heal quicker. So it's a good spiral. Like it's a good synergy. Yeah. Yeah.
When you said consistency of the treatment of the laser, obviously I'm sure it depends on what condition that we're looking to treat or heal from. How often would you suggest on average to have laser done, either a weekly, monthly basis that you've seen?
Yeah. So it depends what the patient's looking for, but if they're really looking to heal, like you need multiple treatments. You need, let's say you're targeting, let's say a joint, you need at least 10 treatments, because you don't want to just like get the person out of pain and get their range of motion back. You want to help them regenerate tissue. Yeah. And you can only accomplish that over multiple sessions. And so the person doesn't bounce back to the way they were, you got to seal the deal. That's why we have long plans here in AFC, because we want people to seal the deal. We don't want to see you back. Yeah. Like maybe every couple of weeks for maintenance, chiropractic maintenance, get some muscle work done. People get tense and making sure you follow your PT stuff. But we don't want you here for like the same treatment that we're doing from the first few weeks, where we're seeing you a few times a week. We want to correct things. So you want to get 10 treatments done. But things like, let's say, just break up sinuses, that, sinus congestion, 1 or 2 treatments, you'll get that done. Those sort of things is different. The fat loss, let's say, I know we don't really do that in our clinic, but that you have, of course, like you have to have enough sessions to get to where you want to be, but it accumulates. So let's say the person was only able to go 2 days before they started hurting again. Now after the second session, they're able to go 4 days, and then before you know it, then they're out of pain. So it's a cumulative effect because you're bringing health to the cell. You're targeting the mitochondria. It's repairing the cell. It's decreasing inflammation, right? Because in that pathway, when you target with photons, you're also altering the immune system too. You're altering your cytokines and your interleukins, and that causes a lot of pain. And it helps when you get inflammation. It helps with healing in the beginning, but when it's chronically there, it can impede healing. So you want to just have the right amounts of inflammation. So that's why you need to have multiple sessions for that. I think if people want it done, like typically it's found, a lot of chiropractic offices are adopting it because it's just a great complement, to everything else that they do. And it helps. And I know you guys have seen after, let's say, a laser treatment, the patient is just, they have better range of motion, they have more movement, so you could get a better adjustment done. And that's why we do the trigger points also, because it's the same concept. But it's just a lot easier to get where they need to be, and I think the best thing is like places where we have patients where I wouldn't necessarily do trigger points, so they just elect to just do the laser, was like, let's say like tendonitis, right? Or they had a sprained wrist, or from sports or something, so that can help them recover quicker. And that's why we also offer the Atom here. The Atom's has been a game changer for us too.
And the Atom is a type of ARP wave therapy, ARP wave therapy. Mm-hmm. Yeah, a little different, but yeah.
I think changing the frequency in the cell is also, that's been unexplored mostly in conventional medicine. Sure. In functional medicine, even we're just getting to the surface of frequency medicine with magnetic therapy, PEMF, right? Rife therapy, Rife, yeah. And that's where even acupuncturists, I've read about this, acupuncturists are adopting the laser because they're using that on the meridians, on the channels, instead of needles. Because laser instead of needles, because it activates the same meridians, because it changes the frequency. That's what the needle does. Because it hits It hits the tissue and changes the whole energy channel. Like it changes the frequency, which now they can pick up. They can detect it. It used to be like, what is that, hocus pocus? But now they can actually detect frequency in the body. So they can detect frequency of a cell, how it's vibrating. And that's the health of a cell. That's all that matters. If it's vibrating at a certain frequency, it's healthy. Right. A broken bone can heal because the frequency changes. Right. A broken bone has a different frequency than a complete bone.
So touching on that topic, because I think this would be important going back to Dr. Addy's injury, which we've touched on briefly in the podcast before, and how he got injured. We started doing some of these therapies. Obviously, he can probably attest to this a little bit better, but Doc, what have you noticed when you first started the therapy until where we're at right now?
Yeah, I mean, the injury that I sustained was multiple fractures, a torn ligament, a torn muscle. I mean, you name it, I got it. And right away, the extent of my motion was almost none, if any. And it got to that point where any movement was painful. I was in the maybe 0 to 5 degrees of any motion, any plane. I mean, really, I could not move it. It was almost as if it was locked in place. That's how severe the injury was. So I had got to a point where once I realized, and we did the MRIs, and I kind of understood the severity of the injury, that now we needed to be met with a certain type of intervention. And Josh and I obviously were talking a lot about not only doing laser, but supplemental wise, what needed to be introduced, obviously, to make the changes needed. But
what supplements did you add in, if I may?
The basics, of course, is vitamin D and K2, and even upping just general fundamentals, right? Fish oils, all those things. But the ones that were a little bit more effective and maybe specific was strontium, which is just a bone builder found in grow bone, and other we wanted to make sure we pinpointed it that way too. So I upped all of that, but add in finally the laser. What I experienced was right away such an increase and maybe before I go into that, what I was doing was 2 to 3 times a day I was in a hot tub doing passive, really just my own arm passive motioning and trying to get any movement, and that wasn't very effective right away. It got me some relief, but very little. Now enter the laser. Even in the first session, I gained double my range of motion of what I had, which was so cool. We started adding more and more sessions. My motion started to become more restored. I actually gained strength. So my ability to lift my arm more above my head was improved. I noticed the pain and the inflammation was going down, swelling was going down. And I know that had I not had the opportunity to have the laser, I think and this is just a prediction, I guess more of an estimation, because the surgeon had said it'll take about 6 months to fully heal. Well, at the 2-month mark, I was back to adjusting normally and lifting some weights, not a lot, but some weights. And I can only guess that the laser was a large part of it. So just in that experience alone, that changed my perspective entirely on where we needed to use the laser and why, and with everyone almost. Yeah.
It's incredible.
So I would love to use it with everybody. Insurance is really the limiting factor, but honestly, I tell people, and like we've spoken about, like just in terms of optimizing your health and getting back to where you need to quicker, it's worth it.
It's cheap. It's
the
cheap.
value.
It's cost effective, maybe is a better word. Like
cost effective.
Yeah.
Imagine you're missing, let's say, for argument's sake, right, 10 sessions, which cost you, let's say, as much as 3 days of work.
Yep.
So you're going to be missing a couple weeks when you could have just gone back to work right away.
And I think putting it in that perspective makes it more understandable for people, I think, too. I mean, people can quickly do the math when you put it that way versus just what I got to pay. Because everybody, that's the default is, what is it going to cost me?
It's actually,
well, it's going to cost you money. That's yes, we know that.
Yeah.
But what else is it going to cost you, and how much could you save?
Yeah, the injury is going to cost you a lot more.
So to end on, I know we just briefly touched supplements. We don't have to go too deep into all this fun supplements, but other than the laser, we had touched on mitochondrial health. What supplements do you find it also effective at improving this pathway or these, this concept?
Yeah. The main one, you guys spoken about it in length also, is nicotinamide riboside.
Yep.
That's incredible because that's a precursor to NAD. There's also like NMN, but they found that nicotinamide riboside that actually is more effective.
Yes.
It's more closely related in terms of like it doesn't have to go through certain enzymatic pathways and stuff, so you have like direct effect on creating NAD,
Yeah.
which you need to produce ATP.
Yeah.
So you're automatically producing more ATP when you're taking. So that's definitely the number one supplement. There's things that you could take along with that, like resveratrol can be very helpful too, because it helps with that enzyme pathway, so it doesn't break things down, and so it also helps it recycle, right? Because it's not like you just produce energy, like you produce ATP and then that's it, it's burned. Like you have to recycle it. So there are certain things that help recycle it better. So yeah, so the Niagen, the nicotinamide riboside, the resveratrol is very good. PQQ. So, oh my gosh, I always forget what it stands for. Pyrroloquinoline. It's like a sister of CoQ10 because that's what the ubiquinone, right? It's a ubiquinone. So, but CoQ10 is necessary, and I would say that's very important for the mitochondria. You have to restore your CoQ10 levels to get the electron transport chain going. But PQQ, they found that actually creates mitochondrial biogenesis, that actually creates new mitochondria.
No way.
Yeah. While like the nicotinamide riboside, CoQ10, they help sustain the health of the mitochondria along with resveratrol. PQQ actually created new mitochondrial biogenesis. So that's pretty cool.
Where do you go for those supplements, or do you go specific brands for the PQQ?
I mean, a lot of brands. There's a few brands that carry PQQ. I always like the professional brands better, just because I know like how they've been third-party tested and everything. So Designs for Health has a PQQ, 20 milligrams is a good dose, and then you have, if you want to get over-the-counter brand, you could get Jarrow. Jarrow is a good brand for PQQ. And they actually have one that's PQQ with ubiquinol in the same supplement, so you can get both, which is really cool. So that's really important. L-carnitine is enough. So with the mitochondria, you want to make it easy to access energy from your food, right? So certain nutrients help you do that better. So L-carnitine is very good for breaking down fats. So you need that amino acid for that. Alpha-lipoic acid is very important for glucose, to help break down the glucose and utilize it, the insulin receptor, to utilize it for energy. And then creatine, I don't know too much about, but it's meant to also be beneficial for the mitochondria. It just helps rebuild. This is the number one studied supplement for building muscle. Those, I would say, like those are the primary things for mitochondria. But you also want to have antioxidant help. So we always think about the mitochondria as like boosting the mitochondria, but you also have to think about what can put a wrench into the system, right? So heavy metals can put a wrench into the system. They actually prevent it going from, let's say, step A to step B, because it interferes with enzymatic activity. And so having antioxidant help on board, so things like NAC, N-acetylcysteine, is really great. Resveratrol is another antioxidant. Green tea, curcumin can be very helpful. Olive fruit extract. So like antioxidant help in general can help, but obviously eating things high in antioxidants like your berries and your dark vegetables and stuff like that is important. And then mitochondrial biogenesis, right? Exercise is important. Sleep, just the foundational stuff is important. Fasting helps with that, because that's why it helps with stem cell production, like the water fasting. But you get this mitochondrial biogenesis. Autophagy, right? Apoptosis, get rid of the bad cells, the senescent cells, that's important. So you don't want your body to having to keep cleaning up junk. So you help it clean up that junk and not pile up as much junk, so you can focus on having energy. You don't want to waste thriving. So yeah, mitochondria is so important. It's not just an energy thing like we spoke about, but you need it for the health of all cells. You need it for memory. You need it for strength. You need it for your organs, your heart, for your heart to pump. You need it for everything to work properly. So I think mitochondrial medicine, in terms of like, let's say functional medicine, I think that's a major concentration now is mitochondrial medicine. It's so interesting, like in the detox for orthomolecular, which I really like. So they actually changed, they used to put a multivitamin in there. Now they put their mitochondrial supplement in there because they're starting to realize like how important the mitochondria is like to all functions of the body. So it's wild stuff. So those are definitely good supplements, and you just need, you need your basic nutrients to fill in to make sure that all you're detoxifying properly. Your B vitamins or minerals, magnesium, zinc, so you're detoxifying properly so you don't get in the way.
That's beautiful. Phew.
Doc, anything else?
No? Is there anything else you want to bring up?
No, I mean, thank you so much for having me. This is an awesome conversation. You guys definitely brought out the best. It was nice to like dig up the knowledge and help people in our community. So like, I think people should come visit our practice here at AFC. I don't have to repeat everything we do. We basically spoke about it here in the podcast, but we help heal the whole patient. So like, you don't have to necessarily, have had a car accident or had a slip and fall, or it could just be like, you know what? I'm tired of being sick. Yeah. Like I'm like just achy all the time. Like my digestion sucks. I'm tired. I want to optimize my health. I want to feel better. So we're that place here too. Like we can help you feel better. We have so many techniques that we use. So I tell people, like we say about the cost benefit, like we say, oh, people can travel from far away, but they can. If you knew 100% that you would heal, so even if you're like in a different part of Arizona, or if you're in California, like we can definitely help you here. So yeah, you could definitely, see us here. And then I also loved, because we talked about the emotional aspect, I also give a shout out to my wife. Yeah. So she has a YouTube channel. It's called The Therapy Minute, THE Therapy Minute. It's all one word. She's fantastic. She teaches people how to restructure their thoughts and meditation, manifestation, just how to unplug and reverse course and go on a different trajectory. And she just works, her main thing is working on perspective, is perspective change. And that's what we do here. But she's incredible. So definitely go, check out her YouTube channel and subscribe. And so thanks.
No, thank you for coming and making time. And I know we're going to get you back here again for sure.
Yeah.
There's so many other small topics we can dive into because you're just a wealth of knowledge on so many different areas. So we want to thank you so much. If anyone has any questions at home, please feel free to comment, subscribe. Send this out to other people that may have, if you guys want us to dive into other topics more in there, we can do more short form, but yeah.
Thanks for everybody for watching. Again, this was Functional Code. Since you guys have been tagging along, we appreciate everything. This was our first guest, like we said. We're super excited to get more on the podcast, and we're probably going to get Josh back on in the near future too. So thank you everyone for watching. Doc?
Yes, sir.
Josh?
Thank
See
you.
you guys later.
Thanks for joining us on the Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.